as what is the research telling us. And we thought that this would provide all of us a great opportunity and moment to speak with three experts about, what is happening today, what does it look like in the future, and what else can we do to be able to kind of manage. They're very confusing times, to be honest, because there's so much information there. And then, the next hour, even for us at our tables in the regions that we work with, things change ongoingly. So I can just imagine, how it feels for everyone. So again, it gives me a great pleasure, obviously, to welcome our three expert panels, of which Peggy will introduce. Information is powerful and is very valuable, especially in vulnerable moments such as these ones. So before we kick in, again, I just would like to wish everyone a most happy new year and welcome back to the grind. I know that we have others, probably families and so forth, that are part and parcel of this information session. So welcome on behalf of all of our team here at Bruyere and our board of directors. It's a pleasure and honor to have you part and parcel of this great opportunity that we have, and look forward to your questions and interactions. As Peggy stated, this is an opportunity to kind of engage and to try to obtain clarity insofar as some of the questions that you might have. So with that being said, I will pass it over back to Peggy.
Thank you, Guy, and thank you for your tremendous leadership and the leadership of everyone in the organization, and especially everyone's hard work. You're right, it's been an incredibly challenging time, and boy, did we ever get caught. I think everybody was starting to prepare to wind down, and little did we know we were going to have to wind up in ways that we couldn't even have imagined. I just want to welcome everyone. We hope we've got a lot of family members, those we serve, their loved ones. We know we opened it up to members of the public. We have volunteers and DCPs with us, as well as our valued staff throughout the organization and throughout our 4 sites. Just wanted to let everyone know that we are taping it, and it will be made available to everyone after the session is complete. We also have other experts with us: Paula Doring, our VP Clinical, Rebecca Officer, our VP HR, Jay Mercer, our Head of Infection Control, along with some of his team, Thomas Hayes and others, just in case there are some technical questions. Just to let you all know, we will be hosting another town hall that will really talk about, the internal questions that you may be having, the operational questions you may be having. This one is really about, as Guy said, where are we at? What does this all mean? And what does it look like for our future? And we couldn't be more fortunate to have 3 really extraordinary members of our team. All 3 are investigators with our research institute. All 3 are incredibly accomplished and very, very dedicated. If I spent time just reading their CVs, we'd be here well beyond the hour. So I'm going to give you like my Cole's notes of who we have with us today. So Dr. Kumanan Wilson is up first. I would call him our virus/vaccine guy. Amongst many, many other things. He's a real expert in viruses and immunology, and actually created an app to track vaccines several years ago. How prescient was that, to think that we would need something in our pocket to track our immunology and our vaccines? So Kumanan, that was great foresight on your part. We also have Doug Manuel here, who many of you may have recognized because he's certainly been a face that we've come to know on CTV for sure, and other media, kind of helping us with the modeling, helping us understand where we're at, what's ahead, how do we need to respond, how are we comparing to other jurisdictions. So he's kind of like our modeling, but he's also our poop guy, because he's also the guy that's been tracking wastewater and helping us forecast where we're at based on wastewater. So that's a tag that you're always going to have now, Doug is. And then, of course, we have Amy Hsu here with us, who's also an incredible investigator. She's a real data person, and she's like an incredible algorithm person, but she's actually been doing tremendous work throughout this pandemic on immunity in long-term care and understanding how immunity sheds and what do we need to do to keep protecting our most vulnerable in long-term care. All 3 of these people are advising many levels of government and many other organizations, and we're very, very fortunate to have all of you here with us today. So with that, I think, Kumanan, why don't you kick things off? again, like we're kind of at this stage, we're really looking at like where are we at and how the heck did we get here, given everything that we've done, 2 and 3 doses of vaccine and lockdowns and whatnot. So Kumanan's going to give us that overview.
Sure. Am I sharing my screen?
Yep.
You are. Okay, great. Well, thanks, everyone. I know this has been really hard for everyone, and I thought I'd give you a quick update on the science and then hand it over to Doug and Amy. So I do like to begin with this slide because I just need to remind people how remarkable accomplishment the development of these vaccines were using a novel platform and how incredibly effective and safe they were. And we are very fortunate to have had these vaccines developed. But as you all know, a lot has changed. The virus has become considerably more infectious than the ancestral strain of which the vaccine was developed to battle. And the effectiveness of vaccination is now different. And I think this is the critical point. The vaccine actually wasn't designed to protect against infection. It was designed to protect against serious illness. Though we had this additional benefit initially on where it was extremely effective at protecting against infection as well. So that led us to believe, if we vaccinate a certain percentage of the population, we could get herd immunity and eliminate the virus. But it's becoming apparent this is now changing, and we're seeing less protection against infection, but it appears to be maintaining good protection against serious illness, which is what it was originally designed to do. So what does this mean is that the vaccinated can now get breakthrough infections and be infectious, but they are still protected against serious illness. And we saw this initially really becoming apparent with Delta, where it did have residual protection against infection, but the real benefit of the vaccine was against hospitalization and death. And we're seeing a continued trend in this direction with Omicron, and Doug will speak to that. So just quickly, I want to discuss how vaccination helps reduce the spread of the virus. Essentially, you need to do 2 things to help reduce the spread of the virus through vaccines. One is to improve the vaccine effectiveness, and in this case, that means adding a booster in. We're getting increasing data that the booster improves the vaccine's effectiveness. And we have to increase the number of fully vaccinated individuals, which means individuals who have the original 2 vaccines plus the necessary boosters. I want to also reiterate that we need to continue doing what we've always been doing, and they're very effective as well. These measures are very effective as well at reducing the spread of the virus, and that includes masking and having good ventilation in indoor spaces. So what do we know about Omicron? I think many have heard in the news that it is considerably more infectious than the previous version of the virus. I think people have compared Delta to chickenpox. If that were the case, I think Omicron would be measles. It's that much more infectious. But it's less harmful than Delta. And the question was, does the increase in infectiousness trump the less harmful nature of the virus? And it appears, unfortunately, it does, at least as far as hospitalizations go. We know that 2 doses doesn't provide sufficient protection against infection, and it's pretty certain now eventually everybody will at least need 1 booster. 2 doses does still provide protection against serious illness. However, the protection is better with 3 doses. So the increase in infectiousness combined with what we call viral escape, the reduced vaccine effectiveness against infection, has created this stress in our healthcare system and the increase in hospitalizations we're seeing and what many of you are dealing with. I think this is an important point that we're now moving from this idea of sterilizing immunity and eliminating the virus to protective immunity, which means we're going to be living with the virus. So we appreciate now that we probably will not eliminate this virus through vaccination. And our bodies are going to have to learn how to deal with this virus through a combination of natural exposure and vaccination. And the real goal now is to protect against serious illness. And this has many benefits. Obviously, it's a benefit to the individual getting vaccinated, preventing them from getting seriously ill. but it's also a huge benefit to society by preventing hospitals being overwhelmed and creating lockdowns. And none of us want to go through these lockdowns again, and particularly school closures, and we know the economic harm and social harm they've caused. And there is still some continued benefit on reducing infectivity by reducing the viral load. But we'll need to ensure that this protective immunity is maintained through booster vaccines and potentially seasonal vaccines. And again, eventually our immune system will become more and more familiar with this virus and learn to live with it. I think this is one of the very few pandemics where our immune system had no knowledge of the pathogen when it first hit us. And why do hospitals need even stronger vaccination policies? I think the number one reason is to protect the unvaccinated and suboptimally vaccinated. And the latter refers to those that don't have boosters. These individuals are at risk if they come into indoor environments, because we know the vaccinated or fully vaccinated can now be minimally symptomatic and carry the virus. They could spread it to the unvaccinated, who can then fall quite ill, and they can also spread it to any other unvaccinated individuals they may be in contact with. And we know vaccine policies can increase vaccination rates, and boosters can improve vaccine effectiveness. And overall, increased vaccination rates and effectiveness will protect the workplace, will protect our healthcare workers, and keep the hospitals' surges under control and working as best as possible. And just like to conclude, thank you to all the healthcare workers, frontline workers. I did my first COVID ward over Christmas. I thank all my colleagues in general medicine who've been carrying the brunt of the work, and I know the challenges you've all been facing.
Thank you, Kumanan. That was a great overview. There's a lot in there that we're going to kind of come back to, but we're going to go over to Doug, who's going to give us an overview of the work that he's been doing and some of the messages he wants to share.
And first, I was going to give you like a little treat, because we are working from home as well. And you can see this book here about Canadian West, but you didn't know, you may have seen this bookcase when I'm on the news and things like this, but it's actually a secret bookcase. And I'm on the second floor, and that's the attic, and that's where one of my kids' bedroom is. So I thought you just like that.
It's like you're living in a Harry Potter movie.
It is. We call that the zombie safe room. And then, except the kids say if the zombie's an Einstein zombie, then it's going to be able to figure that out. So, so I'm going to have just a couple of slides. This is time for you folks, meaning the folks that work at Briere and family. And so we're here, three of us are here to answer your questions as well. And I was just going to kind of walk you through what I found instructive for what we're up against. So Kumanan talked about that we can't dodge this one individually. We're going to be exposed. Maybe we'll be asymptomatic, maybe we won't. And I'm going to show you some of the numbers. So like if Ottawa, we know for measles, if you have an island of 250,000 people, measles will continue to circulate in that island just because there's enough births in there. So with measles, you have lifelong immunity, and there's just enough births to make measles continue to circulate. So we've got 1 million people in Ottawa. By the way, we're not an island. And by the way, we're going to have some challenges maintaining lasting immunity for this. We're going to need boosters, and we're going to continue to be exposed. And as we get exposed, that's going to prime our immune system again to help us keep that really mild or asymptomatic. So we can't avoid it. What does it mean to us? And let me just show you 4 slides from what I find helpful is you may have heard about it, the outbreak at a restaurant in Oslo, Norway, in the end of November, and then cases came into December. And the outbreak, so you can see this now, right? One slide. Yeah. So the outbreak happened on 26th, and there's 117 people that attended, and since then 111 people have been interviewed. The party lasted for 4.5 hours. So that 4.5 hours, that was it. And 96% of people were vaccinated, and about 90% had 2 doses, and everyone had a rapid antigen test the day or two before that. In that 4.5 hour exposure, 74% of people contracted COVID, And what I thought was helpful for our conversation is that the average age was around 39 years, ranged 26 to 61. So I think probably a lot of folks, a lot of folks that work at Briere are this age, and families as well. And so I think what happened to them is instructive for us, especially when we're walking into Omicron. Many of us had 2 doses. And so people got infected within 3 days, and a range of 0 days to 8 days. And about 50% of the cases 50% of the cases happened on day 3 and 4. So some before and some after, but most of them are 3 and 4. This is one of the challenges. So you may get a call from someone that said, hey, sorry about this. I had COVID when I saw you 4 days ago, and your reaction is go like, well, okay, that's not actually helping me now because I'm already sick. So it's moving so quickly that when you're seeing people, they could already be infectious, even infectious, and they don't know it. They don't know it themselves, and they're transmitting it to you. And this is a challenge for control for this. And so you could be, you could have met someone, a few days ago. They don't know that they have it yet, and you're now infected, and you're going into work and as well. So that's a bit of a challenge for everyone about how to about that as well. Now, in terms of symptoms, for this group, 99% of people had symptoms. This is people that with 2 doses. So, and remember, 2 doses, 75% of people got infected within just 1 exposure. And they had 99% of people had symptoms, and those symptoms lasted for an average of 6 days. And here's the list of the symptoms that you can see. Cough was still the most important one. A lot of them is this runny nose. Lethargy and fatigue is very high on that. And then moving down the list. So, so for me, this sort of says another reason to sort of get your booster shot. I always sort of say there's 3 ways that you can protect yourself from severe disease, not infection, but severe disease. And that's first shot, second shot, third shot. And I think, remember that a lot of the folks are in a privileged position because you can get that third shot ahead of others because you're a healthcare worker or a family of a healthcare worker. I think that's well deserved, but please take advantage of that. That you've got a leg up on other people to avoid the slide that you're seeing here. So we don't know the level of symptoms yet. We haven't seen the studies in third dose, like in outbreaks with people that are 3rd dose, but all these numbers are going to be lower if you've had a 3rd dose compared to if you've had a 2nd dose. And then how severe were those symptoms? They rated it on a scale of 1 to 5, with 1 as being no symptoms and 5 being significant. And most people rank them in the sort of level 3 and level 4. About half were level 3 and level 4. There were no hospitalizations in this group, which is great, up to day 17 to observation. So maybe there would be still a observation or hospitalization for this group, but probably not. So 2 doses is protecting against severe disease, but not against in terms of hospitalization and death. But still, some people are finding it difficult with 2 doses and even 3 doses. And just the last slide, this is Ontario now, and this is what we're seeing with 2 doses in Ontario. So we basically lost our effectiveness for infection, but not for severity and hospitalization with 2 doses. And with 3 doses, right now, the most recent studies are about 40 to 60% vaccine effectiveness against infection. We don't yet have the numbers for hospitalization in ICU, but we are expecting those going to be way, way up into the 90s for 3rd dose. And those numbers should be out in a few days or a week at the latest. And I'll stop there, Peggy.
That's great, Doug. Such a great overview, and I think it really resonates with a lot of us as we're kind of mapping out, the booster, and it actually really flows nicely with Amy's research and her focus. So, Amy, why don't you take it from here?
Great. Can you see my slide?
Yeah.
Okay, perfect. So like Peggy mentioned in the introduction, first of all, it's such an honor to be part of this panel. Everything I know, I learned from Doug, and I rely on his guidance for a lot of decisions in my life, COVID and beyond. So it's such a privilege for me to be part of this discussion and being able to share some of the things I've learned throughout the pandemic. And one of the things I want to share is actually a research project that I'm currently leading based out of Briere, focusing on COVID-19 immunity. And like Peggy said in the introduction, how I make sense of the world is by looking at data. I look at data, I look at graphs, and then it helps me to understand my situation. And one sort of point of optimism that, and I bring into this conversation, and I've seen as I live through this pandemic with all of you, is that we have now more and more data that helps us to understand how the virus behaves, how it's transmitted, and what the implications are for our health and our health system. So like Doug and Kumanan had alluded to earlier, the reason why we're looking at these booster shots is because immune response wanes over time. And what this graph really illustrates is that, you know, when you look at individuals who have been vaccinated, whether it's staff, whether it's a general population or long-term care resident, that level of immunity. So on the y-axis here is what we call neutralization. So basically, it's a measure of a specific type of antibody that neutralizes or prevents a virus from binding with a human cell. So we're looking at the ability to actually prevent these binding, because the virus needs a human cell to actually, the host to replicate, right? So we want to prevent that binding, prevent the virus from replicating within your body. And so what we see is that over time, the ability to block these viruses from binding with a human host cell and from replicating within our body when we're infected actually reduces. So our neutralization capacity reduces. And that rate of decline is much, much, much quicker in residents in long-term care or vulnerable populations. So a lot of the research that I've been involved in, like Peggy mentioned, involves looking at what's happening in long-term care. We know that this is a highly vulnerable population. They're living with multiple comorbidities and they're extremely frail. And so this is actually an environment where it helps us to understand, you know, how frequently do we have to administer booster shot? How long does the immunity last? And how do we continue to develop strategies and policy to protect those who are the most vulnerable in our population? And so as you can see, even when we're looking at the original protection against or our defense against the wild types of the original Wuhan strain and also against the Delta variant, that our ability to neutralize the virus has declined. And of course, with Omicron, which we know is more transmissible, which we know is associated with faster replication, that when data comes out for Omicron, you'll probably see that capacity is further reduced and probably at a much quicker rate, especially in vulnerable populations. So this is actually data that's collected from a number of long-term care homes across Ontario. But when we kind of compare these results across other jurisdictions, we see similar findings. I know this is a complicated graph, and this is not meant to be a lesson in immunology or virology. But what I want to highlight here is on this right-hand side, this panel B here, it's also showing neutralization capacity after receiving the third dose. So this is the result of getting boosted. And so when you see in the red here, these are individuals with a prior infection. Those under 65 are primarily healthcare workers, and those over 65 are long-term care residents. And this is a study done in the UK. As you can see, in those with a prior infection, of course, their level of neutralization is just higher than those who are naive, who don't have a prior infection. But as you can see, in people without a prior infection, even though they had received that second dose, you saw that decline over time. But receiving that booster shot immediately increase your immune response to the same level as individuals with a prior infection. So this is basically data that indicates the effectiveness of the booster shot in increasing our antibody response. Now, coming to the study that we're doing at Briere, really it's a study that looks at what are the risk factors for infection, reinfection, also serious illness in people who work and live in long-term care. And we're also monitoring vaccine effectiveness through this research. So this research, as I mentioned, is based out of Ontario, based at Bruyere. We've recruited just under 400 residents across 26 long-term care homes in Ontario and 900 workers and 100 caregivers or designated care partners. We're also currently recruiting participants from Quebec as well as BC. So this is a multi-province study. And what I'm really excited to show actually is data that's collected from Résidence Saint-Louis, so RSL, so our own facility, where we see the effect of the booster being administered to residents. Now, this is very early data, and that I actually asked my team, so I want to give a shout out to my team. So Danielle Kosi, who's a project manager on this project, and also Shirin Hussein, who's the analyst working with me in analyzing these data. So they pulled this yesterday, this hot, fresh off the press. But this is early data that we collected on what happened to residents at RSL who had received a booster dose early last fall. And as you can see, their immunity, their immune response really wanes even within a short 3-month period post the second dose. And within a month, so within 4 weeks of receiving the booster shot, their immune response not only increased, but to some extent, they actually increased at a higher level than what they were following the second dose. Now, at the time, we didn't collect booster. Not all the staff have been boosted, so we don't have that pre-post booster data for staff at RSL yet. But I just want to show that, even among staff, you see one very large variation in terms of immune response, even in healthy individuals. And even in this population, you do see declines over time. And since on my presentation, I've sort of been using this slogan or this hashtag of "We Are the Science," because really the science comes from learning about our experience through the pandemic, and this is where the data is coming from. And I want us to really take pride in our role in contributing to the science and the understanding of how we're kind of continuing to deal with COVID, to deal with Omicron. And really, I think this is also an opportunity I want to take to thank the staff at RSL who has been supporting us in this research. And finally, I think one of the questions I get is why are we getting booster shot? And I think Doug has alluded to this earlier. And why can't I just, go out and get infected and sort of be done with these booster shots? I think one thing that we want to keep in mind is that an infection with a live virus, you are at risk of other outcomes. And one of those health outcomes that we haven't really fully explored, at least that we're in the process of studying, is the chronic symptoms. And some of you may have heard the term long COVID or long haul COVID before. And basically this is referring to sort of the persistent experience of these symptoms beyond the initial acute phase of the disease. So beyond the initial 4 weeks, at the 12-week mark, where you continue to experience some of these symptoms, is then considered chronic. And so initially, prior to vaccination, I think we heard around 15 to up to 25% of individuals infected with COVID continue to experience these symptoms up to 12 weeks post the acute phase. Now, with vaccination, we see that reduces dramatically. So among people who are partially vaccinated with 1 dose, you see that risk of experiencing long COVID down to about 10 to 15%. And if you have at least 2 doses, that goes down further to 5 to 10%. So it's a demonstration that vaccination, it not only helps to reduce the risk of potential infection, of serious illness, but also reduces your risk of experiencing long COVID. And I think some of you might be thinking, well, maybe I won't experience it, but, personally, I'll share a bit of a personal, I guess, like my perspective on this. And Doug knows as well, because on our research team, I'm sort of known as the foodie on the team. And one of my sort of the pleasures I enjoy is when I travel, I love to try new restaurants. And yes, with vaccination, I minimize my risk of dying from COVID. I minimize my risk of being hospitalized with COVID. But one of the things that I worry about personally is, would I be able to still enjoy the same quality of life? Would I be able to enjoy food the way that I do, if I don't protect myself against COVID? So personally, that's actually one of my motivations for continuing to become vaccinated and continue to protect myself against COVID. And, thinking about, that's just The loss of sense, the reduced sense of taste and smell is just a small component of it. But there are more serious, longer-term side effects that we may not be aware of, and we're continuing to study and monitor in individuals who have had infection with COVID. So this is an area of research that we continue to explore, but it's one of the reasons why we continue to encourage everyone to get their vaccine and get their booster wherever they can. So back to you, Peggy.
Wow, that was a lot. You guys covered so much. I'm going to try and summarize a little bit of what I heard to kind of take us to the next section. So correct me, or, make a funny horn sound if I'm wrong, a buzzer. So the issue is, because we're hearing a lot of frustration, right? Like, we're doing everything we can. We've got the first dose, we got the second dose, we've locked down, we've masked, we're physically distancing, we are not doing right. There's a lot of frustration out there. So what I'm hearing from you today is that the loss of effectiveness and infection is the issue, and why we need the third dose. Is that right?
It's that plus boosting the protective immunity. Like, we need to get that protective immunity as high as possible for your own benefit, but also for the benefit of society. And it doesn't take even a small percentage that doesn't have that can result in these surges in the hospital. When I didn't mention this, but when we move from sterilizing to protective immunity, it means that everybody's got to get vaccinated. This is no longer getting to our 70%. Everybody's got to get vaccinated. Everybody needs this protection.
Exactly. So this is a really important, right? Because when we began to roll out vaccines, we were like, oh, 75% is herd immunity. Now we know that we need everybody, or as much as everybody as possible, to get the vaccine, and not just 1 and 2. We need the booster. And that's just going to bridge me into, like, are we talking about multiple boosters? Will that be just kind of the new normal?
Go ahead. Well, one thing, if you guys, I've been on the news quite a bit. If you've been paying attention since about July, I've said people have been asking about third dose and stuff, and I've sort of been saying, like, it looks like a 3-dose vaccine to me. I don't like to make policy statements, so I don't like to sort of say we should be 3-dose and before recommendations are out. But because it's not, with 2 doses, it wasn't enough immunity. And we kind of get complacent, right? We say, oh, we're fully boosted. And I said, like, fully boosted, what does that mean? The question that we as scientists ask is, what is the level of immunity we need to have? And even with Delta, 2 doses, we're not going to achieve a herd immunity. 3 doses, I don't think so. We would have a better chance. We can't with Omicron. I think the boosters will be in the cards in the future. We don't know. The party lines, we don't know the answer yet. I feel discouraged about the level of breakout that we had with Omicron. When we see the studies, and we've lost almost all of our effectiveness against infection, but still holding up against hospitalization. We know from coronaviruses in general that immunity does wane, like before COVID, but that kind of sterilizing immunity wanes, whatever that, but that you do still have protection against severe disease, but it does wane. But I think this is, Kumanan and I were saying, like, when's the last time we had a new infectious organism that we haven't seen in humans? And it could be 100,000 years ago. Like, we're going through something new here, folks. Even the 1917 pandemic, that we had been exposed to influenza before. And so it's almost a generational thing, that our children born today are going to be born into COVID, and they'll get vaccinated and they will be exposed more and more. And so as they grow up, they're going to have a strong immunity that protects them when they're older, but potentially with boosters along the way. But now we're all newborns. Our bodies are all newborns for Omicron. And as a society, we have to build up a generation of immunity. And you can do it the easy way, vaccine and boosters, or the harder way in getting infected. And so I'm looking at a great summer, or a very good summer, unless we have a real weird variant, but because we're going to build up our immunity, we're going to have lower cases. Yes, we will have a wave. Hopefully it will be a small one next winter, and they're going to get smaller and smaller. But we will face with infections in the coming years, but we get smaller and smaller as we get boosted, as we all have these exposures to it. Even if we don't get sick, we're boosting our immunity.
Well, that's a hopeful message. Doug is also the person that I asked, are you sending your kids to school last September, and then sent my son. So I'm going with that very hopeful message. I'm just cognizant we've got a lot of questions in the chat. Amy, did you have anything you wanted to add to this? And then we're going to go to questions.
Yeah, just a quick note. I think what's one thing that's encouraging is that, a lot of the policy that we're seeing is based on the evidence, right? So we're building the evidence base around what it means by waning immunity. We're learning about the rates of decline of that immune response, like from vaccination. And we can't, one thing we need to be careful of is not to say, well, 3 months ago, this was a situation. 3 months ago, this was fine. I was told that I was fully protected. But we're dealing with a virus that's evolving. So we have to evolve with it. We have to evolve with the situation, and we have to come up with, our best line of defense against this virus as it continues to mutate and evolve. And so that's the situation that unfortunately we're dealing with. And I'm glad to see that these policy is reflecting that knowledge.
I love that, because I think, there is this sense of like people don't know what they're doing, but it's because we're adapting and learning, and the science is adapting and learning as we go as a collective, right? So it's a really great thing to remember as we all, feel that frustration. Jess, I think you've been tracking questions. Do you want to help us out here?
Thanks, Peggy. We have received quite a few questions in the chat. It's great. So people are aware. You can send questions via chat. You can also send questions via communications@bruyere.org if that makes you feel more comfortable. We'll start with a question we received in advance of the session, and it's on the topic of vaccine shopping. We have people who are not wanting their booster because they want to wait for Pfizer, which is not available. Can you guys tell us a little bit more about why this is not a recommended practice?
The mRNA vaccines all basically have the same mechanism of action. So Moderna and Pfizer would be roughly equivalent. There's a slight dosing differences between the two, but they work the same way. So I think the most important thing is to get that booster as soon as possible, rather than wait for data to come out on if there's even a minimal difference between the two.
Okay, does anybody else want to add, or I'll move on to the next question?
Yeah, I think, like in the test tube, Moderna had a stronger reaction, like the full dose. And so that may have been causing some more severe reactions. So, but in some ways, like some people say, oh, that was a good thing for the older folks because they have a stronger reaction. To be honest, we don't see a difference in real life in terms of effectiveness. Theoretically, you might want to mix match more, like, because you're showing your immune system different parts of the virus, and that will broaden your immunity. But I think like really any vaccine is good to go, and we in Canada, I think Canada led the way, right, in terms of spacing out the vaccination. So at the science table, we looked at this idea of should it be 3 weeks, and we said, well, that's the only reason it was 3 weeks because that's how we had to run the trials, and so we spaced it out in Canada. Turned out to be we were smart, and also we were open to this idea of mix and matching. And we've always, like the maybe it's a dirty secret, but we've always mixed and matched because we always run out of, like, for different vaccinations for kids, we sometimes run out of one and we have to do another one, or you move from one province to another. We've always done it and we've never worried about it. So as scientists and clinicians, we never really worried about mix and matching, and there could be some advantages to it as well.
Yeah, I think as a parent myself, it's the first time I've been aware of the brand name of the manufacturer of the vaccine. So next question. If someone, and this seems like a very specific question, if someone received a booster shot but then tested positive for COVID-19 a few days later, would they still have built up immunity from the booster along with the immunity from having COVID? or is the booster not as effective in this case?
I took a stab at that, and again, we have to just acknowledge what we don't know. There's a lot we don't know. Sort of the good news is what we know from Delta, that if you were infected and got a vaccine, you had like a super immune response. That was the best possible immune response you can get. We're starting to see some data that people who get Omicron infection is boosting some kind of innate immunity. There's a study out of Canadian Blood Services. So I wouldn't be discouraged. I would think you're probably in very good shape.
Yeah, and I think, if you had it in day one, like 1 week, the question was a difficult one because it was 1 week. If it was day one, you wouldn't have, your body wouldn't start getting immunity yet. If it was 2 weeks, those curves, if you looked at those curves that Kumanan showed, they're starting to peel apart at around 2 weeks so that we can see protection from that. So, your body's starting to build immunity. I would kind of sort of say at 1 week, there's already some immunity and will maybe blunt the severity of that. But it's a tricky question. The 1 week part is a tricky question because if it was day 0 or day 14, it'd be a little bit easier to answer.
Yeah, one thing that I will add is I think when we look at the evidence, we also know that the duration of immunity differs between a natural infection versus vaccine-induced infection. Vaccine-induced immunity. And so at least with some of the earlier data from the first 2 waves, we see that vaccine-induced immunity offers longer duration of protection than natural infection. And so with that booster shot, I think you also can think about not just like, am I protected, but I think in terms of duration of protection, continue to monitor that. How long you're protected for is also an important consideration.
Thank you. I want to move over to we're getting a few questions on children. And Doug, I hear you often on CBC speaking on this topic. Both questions around, an advice for parents who are looking for how concerning the infection is for children under 5. And also any news on the vaccine for under 5.
I don't have any news. I may not have news. I'm not sure where NACI, sometimes I hear what NACI's working on, but I don't, and we like to wait for NACI, National Advisory Committee for Immunization. They've been doing a out of the ballpark job. I can't believe how well they're making advice quickly. And I know people have sometimes been critical about their language, but I said, I don't know how to do the language cleanly for some of this stuff. So I just want to give a nod, thumbs up for them. And we're really lucky again to have that group. Severity is a little bit higher for less than 5, but I've had patients, kids that are under my care that have died of RSV and meningitis and E. coli, HUS, for me, again, I haven't said this publicly, but it's terrible for any age group. But can you imagine if this was more severe, the greatest severity was in our kids, and less severe for adults? Can you imagine what the world would be like? So it is milder for kids. Remember, when you hear about the hospitalizations and deaths, I don't know if it's cold comfort. It's not really cold comfort, but remember that these kids are, for the most part, kids which have multiple chronic conditions, and they're very challenging kids to take care of because they're very susceptible to any respiratory infection. And so when you see a hospitalization, you may not, when you hear about a hospitalization for a child, you may not want to say that, put an image like that's my child in there, unless your child has a lot of severe complications. So don't make that kind of logical kind of leap that picture your child in there. And so it is milder. It is slightly more for the really young kids. When we're talking to the pediatricians at the science table, they're saying they're seeing it more like what we call an RSV picture. So more like a bronchiolitis for Omicron, a little bit more upper airway in the larger airways. So if that helps you, like bronchiolitis or RSV, if you're a parent and have seen that with your kids. So a little bit more upper airway. Remember, the small kids, they have really small bronchioles and they can run into some difficulties with RSV as well. But we're seeing low hospitalization rates at this point.
Yeah, I just add that the Pfizer study, they do dose reduction, and they didn't have the sufficient immune response for the under 5, so they're adding, I think, another dose or to see if that elicits the response. It's delayed beyond what we had originally thought.
Thank you. Okay, I will move on to the next question. Is test, trace, isolate still the best way to deal with a variant like Omicron in a vaccinated population? 3 years ago, would anyone have recommended this behavior in terms of lockdowns, quarantines for a virus like Omicron? And would a focused test and treat for symptomatic high-risk people be a more effective way forward? Who wants to jump in on that one?
Well,
these are right up Doug's alley.
Oh, do you want to kind of go through, like, what was it? Should we go through in order?
Yeah, well, I mean, I think in general, looking at, you know, if Omicron, if it was the Omicron variant in March 2020, I think what this person is really looking to know is test, trace, isolate the best approach? Is that what we would be looking at if that was a virus that we were looking at that time?
You know, test and trace is a cornerstone of our management of the pandemic. Although we're moving through, you know, it's different than where we were last March. We didn't have a vaccination. And so the smart people were trying to keep it really low. And I think the East Coast were smarter than us here, to be honest, keep it really low. And economically, socially, you're going to be able to do more with low case. Now Omicron is super infectious, and plus we're in a different stage. Like, we have vaccination, we're getting immunity, and the game plan is changing. It's now more living with it. And so that's a good question. So to control it, we still need to protect our healthcare system, and so we do need to control it. Ideally, we would do test and trace right now, but we can't. That's just reality. So it's a bit maybe a circular or not clear answer. So in some ways, could we do it? Should we do it now? Yeah, I think so. If we could, to control, because it's an effective way of controlling it. It's more challenging because it's moving more quickly. But remember, we've done test and trace for sexually transmitted infections, TB. You know, it is a cornerstone of public health, but we've never really done it for influenza and a lot of respiratory infections. So we're in a little bit of a new territory here. What life is going to look like in the future? Are we always going to test for COVID? We've never had to say have a negative test and you're okay. Like, we don't, remember, for influenza, we've never said be tested and you don't have to have a negative test. So we're in a bit of new territory. I think, some of the areas that the three of us are interested in is could test and trace be more automated? Like, could we do it with smartphone apps? And now we have rapid antigen testing, which is easier and you can do by yourself. So maybe we're going to be doing that more in the future, including for influenza, for other infections.
Does anybody else want to jump in on that one before we move on to our next question? I don't see any takers going once, going twice. Okay. So Kumanan, I believe this one is targeted at you. It was very much in line with comments you made in your presentation. So if we're looking at a world where we need to vaccinate everyone, if we're looking at we need 100% rates, expressing how challenging that really is, how do we get out of this? What is your recommendation?
So, I mean, we've done that for other viruses. We get 95% of the people vaccinated with measles. I think the key is going to be pediatric programs eventually. That's the best way you can capture your audience through the well baby visits. What we've done is pretty remarkable for adult vaccination programs already. I know it's not where we need to be, but when you look at the history of adult vaccination, this is an incredible accomplishment. Getting 90% of the population to do anything is hard, like pay their taxes, anything. So this is, I don't think we should be too negative in that respect. But I think the focus will be on school age and well baby visits, and that's where you have captive audiences, and that's the best place to start to get people vaccinated, and then we'll also have a population that grows up with immunity.
Anybody else jumping in? No. Okay. Next question on timing between first and second doses for children aged 5 to 11. Some parents are getting second dose at 28 days, but public health is still recommending 8 weeks. Do you have any advice?
That's I'll go, then Doug can correct me. It's a bit of a numbers game. Immunologically, we seem to know that the longer the gap, the better the immune response, but we have Omicron right now. So you have to just sort of calculate your risk of having a less than perfect response, but can address the challenge of the virus that's right here, or waiting longer and having a more robust response. So that's my take. Doug, you want to go?
Yeah, and I might fumble through this a bit because I can't remember the exact timing in the studies and the approval in US and things like that, but I believe it was 4 weeks. The timing in the studies between first and second, and US came out with 4-week recommendation. We came out longer. What influenced that for NACI was side effects, so that if you space it out, you're less likely to have those severe side effects of heart problems, if you remember. So they felt, again, balancing that what we saw in the studies, and you're always safer to get a vaccine and have fewer heart side effects than getting COVID. But they spaced it out, and now Omicron's here, and so you don't want to get you want to get you don't want to get Omicron because you'll have more side effects from Omicron. So I think having it earlier makes sense. That's what the studies originally showed, and it was really kind of a more minor consideration for spacing it out. It was just kind of to be conscious that there are side effects and reduce the chance of that, and then having increased immunity, like Kuman was saying.
Thank you. Okay, I will move on to the next question. Do you think kids, we have a lot on kids, 11 to 18-year-olds will need the booster?
Go ahead, Kuman.
I'll wait and see. I suspect we're all going to need a booster, but the question is when. They may have a little, it may be longer before they need the booster, would be my thought. And this could all become seasonal as well.
And a follow-up to that, are there any implications for getting multiple boosters?
Amy, anything from your immunology about antigenic imprinting or anything like that?
I mean, it's definitely something that we've discussed within. So Doug and I are part of this broader network called COVARNet, which is a network that monitors, the effect and the behaviors of variants of concerns associated with COVID. And we actually wrote up this position paper that basically the team is indicating that there's no concern with imprinting. But I think, like you said, Kumanan, this is a situation where we're continuing to study, but there isn't a whole lot of evidence that suggests that would be a concern for booster shots.
So imprinting is kind of the concept that it would become less effective for new infections or things like that. But I vaccine good, COVID bad. Yeah.
Perfect. That's that sums it up perfectly, Doug. I love it. I'll take one more question, and we're already close to 1 o'clock.
And Jess, maybe we'll just there's some more stuff in the chat, and maybe Amy, Doug, and Kumanan, if you can just respond to any of those things, so that at least that gets responded to, and then of course people can follow up with other questions, which we can share with you post the session.
Yeah, people are welcome to follow up at communications@briere.org, and we can do a bit of a Q&A to summarize and share the learnings. Okay, and so this is a question on, looking beyond Ottawa to, what effects will low vaccination rates have in specific parts of the world? What effect will low vaccination rates in specific parts of the world have on our success for this virus?
So obviously we need to vaccinate the world. We need to help protect against variants forming. I don't think we need to vaccinate the world with mRNA necessarily. And unfortunately, I mean, we have the access to the mRNA vaccines, and they're now going to booster programs in wealthier countries and maybe diverting this from low and middle income countries. But yeah, as we're moving to a protective immunity lens, the other vaccines can be incredibly valuable in helping provide the protection that these populations need.
Thank you, Kumanan. Peggy, I will pass it back over to you and Guy.
Thanks so much, Jess. Thank you for pulling all those questions. There's so many great questions. I'm going to hand it right back to Guy to wrap things up, just given we've only got a few minutes left. Really appreciate everyone's insight.
So I love that. Vaccine good, COVID bad. That's pretty easy. And I think that sums it up. Just to kind of wrap things up, I remember when the pandemic first hit us close to 2 years ago, and I was driving to the hospital that first morning, and actually those first few weeks, there was nobody on the streets. It felt like a ghost town. But things have evolved. Just to try to kind of bring an ounce of positive, we're playing what is it called? Hollywood Squares now, virtually, like Dr. McGuire, would say. We've seemed to find ways and means and mechanisms, with the boosters, the mask, and so forth, to kind of deal with it. So I think, at the end of the day, although there has been tremendous turmoil with regards to this pandemic, not to be over optimistic, I also try to kind of look at the great stuff that comes from this. And I turn it over to you. You're three very, very well respected professional researchers, and the work that you do is very complex. I thought my job was complex, but yours is more complex because things change so fast. And I just want to thank you on behalf of all of us here today. I think the numbers went up to about 160 people. So thank you for sharing that valuable information, because I do believe information is powerful, knowledge is powerful, because it helps us to make better decisions. But at the end of the day, as the knowledge and the information and the facts, evolve, we have to continue to adapt, obviously, to our changing environment. And for what it's worth, if I may share a personal experience with regards to the effectiveness of the boosters. So my family, I have my son, my daughter, and my wife that lives with us here in Ottawa, and my son's a physio in Ottawa. So my son, daughter, and wife did get the two first shots, and I ended up getting the booster shot immediately when it came out, because there was lots this time around, so I thought I would go. And thank God I did. 3 of my family members, a week before Christmas, I would say about 3 days apart, all tested positive. I tested negative, and then I tested negative at the end of the day. And I don't know if this is a hard fact, but the only thing I can attribute it to it is that I did get the booster shot. So I'm excited because I can't wait for them to get the booster shot. I was listening to the information that you were sharing. After someone tested positive, how much time do you need to leave in between in order to get there? So just quickly, Dr. Shu, Dr. Manuel, Dr. Wilson, again, on behalf of all of us here that are online, and all of our patients in our community, thank you for your work and for sharing this knowledge with us. It's very valuable to us because it helps us to make, better decisions, and it helps us to be more confident, obviously, as we continue to adjust and continue to try to protect, all of our teams, our patients, and our residents. Not an easy job for everyone. But thank you so much.
Thanks, everyone, and thanks to everybody helping out through this whole pandemic.
Thanks, everyone.
Okay.
Dad, did you want to say something?
Well, I was going to say January, February is going to be really tough.
Yeah.
I think for many of us, myself included, I think it may be the toughest month of the entire pandemic. But let's leave on a good note. I think the summer right now is going to be pretty good. I could be wrong, and I'll buy you coffee if I am wrong. But for my partner, she said, Doug, don't say that. But I said, I don't trust you. I said, I've never said that yet. And Amy was saying this too. I haven't said that yet in the whole pandemic, that the future is looking better, and I am now. So I think let's just get through these next couple months, and I'm allowing myself to dream. And plan and
Doug is booking vacation, guys. That's a good sign.
Vacation, yeah.
Thank you all for your leadership and for everybody coming together today. It's really great to just have this opportunity to share, and we'll create other opportunities for this. Have a good day, everybody. Thank you so much.
Bye.
That was great, you guys.